lagi short staff mong ay mentar multel may di so far so good. Okidoki, madalo siya soras manungin pasangan mergido rogo itial morens nga superstation WWFM direct Eco Paradise manungin pasangan legor mer adar Eco Paradise paman south da ke merur tial lurior kira adar belau mablur belau solang tigidre al mal mat tele with the clock como que mamura program git man soktel di hotur gide nutial mai ngum sangel lobatial lolgiung le van merur tial show kafar erbelau mel sebel lo mura program gide al kapsay kafar erbelau
otherwise man sulang etuli ke malungil kapsingel morgaw ma arogul adara dias broadcasting ma direct malungil kapsingel mora adara ngadel belau tira man masaw lolo bunget sel pekpetemel talk show iman meringa sulil broadcasting ra tegi talk show gidra every twice a week. Tamla motel al buile Mr. Diaz. Ya.
Ngau gay.
Amla mo edel buile. Di malungil maral magi direct kan meringa sulir ro buil listeners tegel all tune in ra. Sel Michael Belaul unit trigel di online obangedra talk show matrigel ro buil buk la para ungil feedback ma direct الونيل جال الناسيون مال كلوب التلالة كلوب القول تاجي الopportunity قد مدينة لسنغانية هاتلاين عندي تاجي بكرة أو بنجدر بك التايم عندي توك شو سبيل بكرة غير ما كمان برينغ سولي. تولي it's been a long week مال بتوقع activities الريال الملامرير ما دولمون من المطمقلة. Again, talk show gida kad mamul di sa te alla reader mongora miskida updates regel bukora development sa tokora reader since Tuesday merila direct ng telo bangeda Peter Paloy niya ungora operations sa selbu EOC ra NEC direct kalgora mo sibel wat talgibel smodi sa gidil essential air service laptop da executive order wara umuringi sel nganya gel gidel segidil essential air service sa loger Peter magi direct mring asulel mesbel mebengeda gobsingay direct lo bengeda tuliga Dr. Constantine Dela Cruz unda sing mal lungi legal topics ni madorgas sa pagkotal metyang o meski magi direct mring asulela Dr. Bing mebengeda albasus ang atel direct of course retail niya incident commander director of public health del Sher Madraisaw niya liaison direct PIO Don Bigger Dew again nasungan niya questions comments mal sibira adil yung kador sa igidil look the text sa igidil dem 1775-1138
okay
dilbor sa igidil tulig abay ulingit tra reader malgukol kasi kita updates ra tokora reader since ra ong erulurio
okay
ngilgap singet tulig
ngusngay
oo so hakura di update sara July dori ya sila emergency committee ra WHO lilutal convene gale director general amle askartil convene al mutal gora mo o mesra tele la atel pandemic al wase gadamla mo kirelger after the del meeting at lilutal lotobdia awal finding artil al wase tial COVID-19 tial coronavirus 2019 nadiga public health emergency of international concern bulwase telilutal reaffirm alwase dirga fake at tiale COVID-19 namang bulwase dirga kakadirga ulsi sa para sila pandemic ang dirga kalmal gira del kadamrula doru landing gira del mal dir kom dasul wase gira del matengel wase kadadirga ulsi sa para pandemic amang tokol doru la gira del البيس راجي جدا من لمدورة ولا الميل وسيقدر تراك لقايدن سما والقضاء بيس رغول دورو رساينس ما يجد الوال recommendations را WHO ما CDC agi mol malospe ra emergency operation center ra ministry ra health.
I see.
Mangway segi de kada madangel wase sel koamuana tigel 122 soldado.
Right.
El ngar segi del USNS City of Bismarck. Ira kan madangel wase seral me kada mle tester tir seral hotel me etir rogul 122 amle negative sel force tester tir.
I see.
Ada military mangarnyar Patokarate do partir el Lorabilio, el self-quarantine Rabilio, Oreor el Walbora Amaruret Tiale Scotchora airport, Tial airstrip Rabilio, Matirang self-quarantine el 14 days, Tirigel Tedo Partira Lara Tiale City of Bismarck, el doctor Porter Gidrang Malala. Kada tirak kalmadengel kada silodil wasit tamle test tlilutal test sel 14 days tir raeli kada natabia result tir el alsil sel wasit tir rogo il 122 alilutal negative segi de longerul tester mangwal bla complete segi del 14 day mandatory quarantine el kid el other belao amle wasit tayi dia karbal do giuni mo sa erar adel el doctor tigal ngaraya ikirbe lawel tigay dilwa essential tirale wa humanitarian group el mesoyis mang 14 days plus 2 negative test result mang el alsil sra yataswel be agi release ra quarantine sel wal quraba bier el mataklil wasay tirwam le fulfill ay requirements ra a quarantine ma testing ra blu belaw ang lamos sa ari el to badra igel quarantine momrula igel bebir ra reor el giril marula adam dengel wasa blilio namos sa il momrula sel tangara school tangararal mara school blilio mesegi el blila toktang manur sra a community health center sel tomkodonia se dispensing ngara blura blilio adam dengel wasa malus paal le so aga nur sal ngarse maluben toktang mus paal lablail sa bil kering el altai magim lengra blai rablilio musabel la nursel kerinye oreor
seven san
tadire kaltirgel el mer oreor ngarnya bebi oreor el polorul ni loban trira ata hospital to koni bora training ara kadam nila set to ar bora medical professional sel ngara mlara dial el me mo anya wa consultation ma training ara mamalogan trira dire so kada sel release tirigay del 122 el angaring tirigay del group palmara kwamal mel 81 tirigay adir ngamal mol mal ngara quarantine tirigay mle tester el alsil se mom se momong ya with el club say dan ter tirabela matam le tester el ya result tira october rakluko
okay
dira kalngaring tirigay tewang el mlara huriping el may matirgay tamal mol mal ngara ako quarantine site din dirga halapol test dira kal tilobada nganya tilobada press release ra NEC National Emergency Committee sabi ko ora di italgibel ora daitaya smoothie ang kagida pirel ngartiang sabil mo ko makaya nganya keren sabil mangaring segi del skogi mler el ang sel wal hotel skogi ra tilagi dal dom podong artilwa sa essential workforce rubet essential workers and mera abela mera taiwan almay matirige amle 8 mler el al sils ra yata sils ngara tamal dimlel malmal tal mura quarantine ya tutara klubo get mo tester segi del el hotel test el bololani pangla ogiv segi yak mo ora atalgibel smoothie quarantine policy mamra MOH EOC awal gim korari lil girir tirgai del essential workers et to legal adam dengel wasem patoka kora maklod projects infrastructure rabel wadel irel malmol ma yakal sabi edel di amoy teleng reorma time maudo dam la kakaringi mang ang waise mangangi sa idil wal quarantine policy matirga ro el essential workers el mervela wal ngaram ay gaki dele well ngara non high risk area Taiwan tirga idya me el sabaril mesoyi sebenting ngari yegi del wal gora prerequisite malubeng taleta la kire remura wera alme the test sel 72 hours prior adir kamalamolama and then giri del dire kal ngarinya wal lol hotel akmula setir gamla motri me wa club say malubeng 14 days el ga symptoms sertira covid Segi dia temer vela we mura soi sebara quarantine testra first tester tir negative at quarantine 7 days mandatory 7 days of quarantine and what tester tir 7 day and then sabari 12 the result negative di se ngari sel dulu seng after al top de ngari quarantine in place was say tadi ngara a place of residence el maltal morabrior el mutal morme el mutal with the club say 7 days
makes sense
ending sel say del time and giril el nganya face covering search giril follow I get preventive measures Selbol merek segi del wal vol tru me wal club say 14 days ngar vela etel mutel muselong erul tester tir Selbal merek segi de tira mas barir el
metroergi
segi de tira mas barir mi moklel lo mai sending dira kal mutel ngari segi del additional giril monitor
14 say on event
Lengsel wal 72 hours prior number 1 al test so para me vela ya hotel tester vela walong erul test del 7 days walong edel test
mo say ndia test do mesringi kom wasay tirgam dara wa Taiwan mel namo kora dia kan serious dia gidel tora covid-19 gado mestrira 1 week mergoya second week and so de pula say pomo reor ndigo mo mask to and from residential el more remendi amo mais el mombrek el lapsa del mutual additional 7 days e con mutual test tire mergo al sugum di negative en lamos me mera bu metto del mera blu wa sei
malwai sei mang goradi ge dia buku sa del girel segi del wal quarantine policy do ruler ngil girel tigal gidel essential then include the turner ngil mora facilitator kidra Mr. Warpalaw.
Okay.
Sulang editor o ingway sa gid tulig mang sem sa da tirigel ngara non high risk areas wal dokora adjust the quarantine period till mo 7 days mang definition gi mo spelling il ngara non high risk area abulul ngiam lamo at least tengo ko del club say malugong talboy laldia ka against la community dia ka community
hindi ka far ka halit tiang mandi mortigel essential worker hindi hal borangi dilab ntirga gidel discussing essential workers tiang gidel basic policy may apply to them but not anybody right
hindi ako melang essential workers ma ngidil adal for example at Taiwan apply tangara Taiwan may tirigel la mora guru le emla mongil mutame mar students direct closisiu let ndosisia risk level tangara balul mlamo okodema daningel clubsel dia ka community spread na covid-19 mo osisiu tetele la quarantine and morti endi rogul adal ku ngara for example akwam merigel mandiri ko to kagay siringi mahuriping amal mol 14 days quarantine period 13
Okay.
Jadi aku kora wal kora tergibel ko makail expansion or say gidil MOH Directive 170-20. Kora mal mo lakatak mo katakil was tergil nga gidil belul al dire ko to kagay siringira al sela belul عمل مول مسجل 14 days المانداتوري quarantine ما جل رجل تيست عندي ترجل كوكرا بلو الدوميسرني لامو اتليست تلبوي اللي جا أجيس السلا بلو سبعة الترجيب الخوضة بنيا quarantine period عندي ديرك كرنانية جاي testing SL the release tira day 7 with a negative result at ترجيب restricted movement tira quarantine in place.
All right.
Dim la seguida tulig akmadinga sing ammonia questions ra avril mong
I say.
El albla da dali seguida mong sa edel mo entertain ay gel sugo mong mania question el may.
Okay.
Iba guling itra Peter malgukal wal talgib el goras modi seguida el essential air service el wasing malngarang abulgul.
Okay.
Kasi tulip sular ako kaya na talk show sara na head na invite.
Okay.
Inform Ramlura sila essential air service quickly tiya gibe present tingin mo ra leadership rebelaw ano gala o igay house ma senate ma members of cabinet mo sa president.
Okay.
Sila idea gawa gidro mo ra essential service mukte garinya dia kal kadang gawa gidro open according the idea mo ko quarantine made magay sa quarantine arada metmura belao endi ageisra quarantine ada ageisa ada mira quarantine begir tulbulul domdasul ul tegir essential service Guam Lospera United and then ma Taiwan Lospera Scoviltil China Airlines e moda dure gatun mo kulgum bali mega Scoviltil pora a planet tegir essential air service eventually taking the essential air service at volungi la kadam ke hogi kita ulo lang la PBA megel tourism industry stakeholders lo mesa travel bubble lo ngela bulura Taiwan masel lulda sut essential air service ngara Guam Main ngara United and the ngara Guam Main mandatory quarantine. It's the essential air service idea commercial services keplata omara tiget ni inganya process lo what mo kini tagi group and essential air services establish a quarantine certificate application online.
Okay.
Apply ni gidam lo bang present ni mo raskogi awala mas raskogi.
I see.
Avelo government avelo lo get the Ministry of Health, Ministry of State MPIC at mga lawyer review and screen ay gagawin quarantine certificate and ensure kung ano available quarantine room ng arvela o severe other ng maratigat at quarantine certificate sa alarapin what muna a quarantine facility gila approval.
Okay.
And then moving on, a lot of prioritize groups of people traveling. Of course, a priority are repatriation, our citizens, our residents and stranded.
Okay.
Same number mo. Repatriation flight ang number mo. A lot of almost essential service workers. Flight and a lot of the essential service workers who almost August 21 at charter mga type payment dito malara essential service workers.
Okay. Understood.
Second, when moving forward, they needed to do establish essential air service law again. United Australia China Airlines United na Guam Main China Airlines na Taipei.
Oh, I see. Kapan sular roguil o piecemeal ter process. Oh, kung dia plate level multi virus mesos peran. Agora take one step at a time. And we're going to use our to take another step, and I think that's a good process. Kapan sular. Okay, Kadolmon.
Peter. Okay. This is about operations or group repatriation. So far, I think ako ma-MCS, malda major issues, malda bungil, tiga travelers, mal take care of it. Malmon, yung mesatil, di ba po sa ito, ikat quarantine facility.
Okay. Okay, okay. Yung naman na mo roy, yung ngagin.
Peter, mansala. Kung ilong sa gate.
Oh, ikaw ngilin din nga, Peter, ang wala, ano mo maran mo to, dalam dalam tuang lang mo to.
Oh, okay.
Okay. Okay, go ahead.
Yeah, I'm saying a quick update. Legal repatriation flight, since legal repatriation group,
Okay.
Withdrawal operation or other blue.
Okay.
They look more for red shading and quarantine period, and they get second group for other citizens, residents in this country. Ngaya updated after the monthly airline schedule, mako email ni.
Doy.
Kala si receive update from.
Okay. Ya, mo sekarang.
Peter, tuloy ka kada matingin sa serat ang ako di ba mata tamar di ba quarantine pero sige da kasi uktasan mal di ba early at the start talo mo para si mer boarding ya te lara telme again wajel di lung ko pismil ko ko ramage ko gid lo mes lo senggup karang next step sa edel mo edi ko ay sa sa belura kwam asaiban amal mol ma skogil morgira lakal within abek seats or vehicle seats na nabaligel mo ma abe binablun mo ya o masin dragel gate tira albutig tira for di wataiwang ma abe binablul rata bay mo ng margo tangara 14 margo matang lo set confirmed mo again itya kada maruringi ora o mesringi hindi again at sugo mo karyo mong morning guys and sa edel ko tergibul ora scale back o mesringi lo sa mo
Parte.
kung das yung dakat sa edel malamol mulkora das lo sa kada di simren mangira vaccine ding mong sige dia ora amok tagadi bok pagkatakli lo sa definition na essential workers include other public safety, other health, military, members of the diplomatic corps, other already maintain, develop by the critical infrastructure, utilities, flood project, qualified essential workers among kada mudengero sa akora tabagi closing ram ko da labo mo kora civil mortuary hindi keep in mind that tulig ko sa hospital direct sugum mo niya guys direct mo niya ate ala sa edol sis para melangis para dokta mar adala para mo dalbulun may hindi niya sa edol lise unless the money tagi the essential air service para dire del compromise mo ko o si kolelo sa mga kada sis para adal gidil may obior di o si silta mo kada maintain sa gidil quarantine ma preventive measures hindi kal klot nganya te alam din kada mangyari sa gidil te lela COVID may
Mate.
igid ako update sa atau abrior mesegi del essential air service tulig man sukum dia ka questions ulingit tra Dr. Bing melbuk the person next part tra program.
Okay. Go ahead, Dr. Bing.
Hi, good evening, Mr. Diaz. So there's those flights coming in and flights going out to Palau, and then of course there will be anxiety on both sides. Anxiety and for us here who are afraid that there might be a case that might be positive for those coming in, and also those who are coming in and how the people of Palau will be accepting them. So there are those who have reported that there are those who are in quarantine who are also manifesting with symptoms of anxiety. So for those who are stressed, because being in isolation can also be stressful with no one to talk to, so it's important that they have something to do, and it helps when they have access to the internet, or maybe they can call their loved ones for support. But there are those who are having a difficult time, so they're also welcome to seek counsel with us after the quarantine at the behavioral health. And in terms of how to cope with anxiety during these stressful times, there will be those who might be coping relatively well. But then there will be also those who have difficulty coping, and there are those who turn to substances.
I got a question for you.
Yes.
According to your statistics, in terms of patients, do you have any more patients compared to when before the COVID-19 started? Do you have more people coming in with mental problems or anxiety problems?
Well, I'm glad you asked that question, because right now our ward is full, because there have been those who are stressed about the situation, but then there's also this situation wherein there's lack of supply or medications that are coming in because of the limited number of flights of cargo coming in. So that's also a concern. Not just the essential medications, but the psychiatric, psychotropic medications that we are using. So we're not getting all of it. So there's some patients who are used to some types of our medications, and if they don't get it, and we substitute them with another psychotropic, they're not getting the same effect. So they become symptomatic. And also, there have been cases wherein also those who are stranded here, the foreigners who are stranded here, and they have medications that we don't have here in Palau. So they come for consult, and we cannot provide them with the exact type of medication. So we try to give them a substitute, alternative. Okay. So for some it works, for some it doesn't. So they become more anxious. So there have been some admissions, even of foreigners who are stuck here.
Okay. What about the PTSD patients? I know that we do have a problem here. There are quite a few patients with PTSD problems, and they're here in Palau. Some of them are taking medication. Do we have a problem with that also?
Yes, like I said, there are some PTSD patients who, because the medications right now that are not in stock is Zoloft and Prozac, and those are some of the medications that are very effective for PTSD patients. So, but there are private pharmacies who are carrying those medications, and thankfully they can still buy from the private pharmacy. But the concern would be, what if the stocks are, depleted? So those are also the concern during the pandemic crisis. It's not just about the manpower, but also the lack of supply or the resources in the hospitals, because the hospital supplies are getting used up.
I see. I remember, I went through internet, and there were people complaining about insulin. There were not enough supplies or ran out, so they had to go to private clinic, and they also ran out. And then somebody, I think the hospital, brought in enough supplies for the diabetic patient. So we don't have a problem with that anyway?
Well, unfortunately, that cannot be helped because of the situation. So it's really a crisis that's going on, and we can only do so much. But thankfully, there are those who carry those insulin in the private pharmacies, and it's a good thing that the supplies has come in. But the question would be, when would be the next supply coming in? So we are working with our pharmacists to really get the supplies in faster.
not just the essential medications, but also the other medications that our citizens need.
I got a question.
Yes, sir.
The nightmares, what causes that? Being tired or being having mental problems? What causes that? Because I experienced that time to time, and then they told me to position my head toward northeast. So I put my head toward northeast, and then it stopped. But when I pitch my head toward south or west, you know, and then I start having these nightmares. What causes that?
Well, that's interesting. I haven't heard of that. But anyway, because we have our subconscious, okay? So our fears, probably while we were much younger, and it is being kept in our subconscious. Maybe we outgrew them, but then it's still there. Or maybe there are some of the things that we are afraid about, you know, or maybe something that we experienced or saw, or we were traumatized in the past.
Yeah.
So when we are in deep sleep, and somehow when it becomes piled up one after the other, and it finds its way into our dreams, and if it causes too much anxiety during our sleep, then it really becomes a nightmare, and you wake up very anxious and having a rapid heart rate, palpitations maybe.
Yeah.
And it can be a cause of a problem if it becomes persistent. Like for the children, there are night terrors or nightmares that's recurring, so it becomes a concern. So there are those who seek counseling when they are overwhelmed, and there are those who are able to deal with it very well also.
Okay, but so far, you know, the last one I had was about a week ago. You know, when I just stand up, you know, and start hitting the wall, you know, punch the wall. And what was in my dream is that I was in Vietnam fighting these guys, you know, tried to kill me. You know, so I think all of these problems that I have now, mental problems that I have now, came from my years in Vietnam.
Yes, your nightmares is related to the traumatic incident that you experienced in Vietnam. And when you are in that state of sleep and going to the wakefulness state, and there's this transition, and then you might have been somehow like having a delirium at that time, but it's still normal, considered normal, but maybe it's a form also of the realization, like you feel you are in that area, but you are not, but then you start punching the wall because in your dreams you are in that area. So for those who are witnessing that, they might have a hard time wondering what you're doing, right? But then you are in that phase of the realization.
Yeah, okay, well, I think I'm going to have to go back to Guam when the flight resumes.
You're welcome to see us, sir.
No, well, I don't want my friends to see me that I'm going crazy, so I come to see a shrink doctor or psychiatrist.
Well, I'm just saying you don't need to go to Guam to receive treatment.
Oh, yeah?
We are happy to have you.
Okay.
And help you.
I will stop by and talk to you.
Yes, sir.
All right, thank you. Okay, let's continue.
So, Dr. Bing, given the situation we're in, which is causing a lot of anxiety and stress, and then coupled with the availability of relief aid in terms of stimulus funding, we can probably assume that there's a lot of people who cope with the anxiety, with substance use in terms of alcohol. alcohol use. Increased alcohol use, of course, can lead to risky behaviors such as drunk driving and other things. So can you just talk a little bit more about that and maybe how we can seek alternative ways to cope? And then if people are binge drinking and they do want some advice on how they can, cut down or quit even, how can they go about with that?
Well, it's a good thing that you asked that, because there have been cases wherein the substance use problem is also, the incidence of patients seeking treatment for substance use have also increased lately. There have been patients going to the ER and were admitted because they're having withdrawal symptoms from use of substances, particularly alcohol and some illicit drugs. And it has become, a bit of a concern because from what we have found out, there are those who get their fix or the drugs from underground, and now they have used up all their substances and they couldn't get it, so they become desperate into getting other. They can, anything they can get your hands into, they use it, and sometimes those who haven't used meth, they start using it, and then they find it overwhelming for them, so they have withdrawal symptoms, and they end up getting in the ER, getting admitted. So there are also reports of those who binge drink, especially when they receive the gift or help, assistance from the U.S., right? So there have been reports like they binge drink and they get into a risk taking behavior, and they end up in accidents. So it's unfortunate because when you are using substances, they also affect how you behave and how your actions are, and it can also affect the way that you drive because your reflexes are affected. So there have been some accidents that have been reported, and of course, how to deal with it? It is our advice that they should seek, if you have loved ones whom you see are abusing substances, okay, then you can refer them to us or talk to them to have counseling, or at least with a counselor or with us, psychiatrist. And there are other ways to deal with problems. Well, if they are also overwhelmed with what they are getting, they can also deal with it in a way that can be productive and to be of help to the community. So there are ways like the altruistic ways, helping others, because in this pandemic crisis, it brings out the best and also the worst in every person. Meaning, for those who are reacting it in a negative way, or maybe taking advantage of people in these times, that could be considered the worst of their behavior. But for those who are helping others during these times of crisis, okay, so that can be also considered the best of their behavior. So that's what we mean by that. And if you're getting assistance, then if you can help others who are in need, because there are others who are having a hard time financially also during this crisis. So maybe you can use it to put your extra money into better use. Okay, but for those who are engaged with substance use and become addicted to it, that becomes a problem because they cannot stop using substances despite the physical and emotional problems that come with it. So it's really difficult to control it. So they might also need help with medications And of course, several counseling sessions need to be done in order to address the substance use.
Okay.
So the Dr. Bing is the community guidance center is available to.
Well, we're still finding location for our new office, but they can seek consultation with us at the BH Outpatient Clinic at 488-1907.
Anything else, or is that?
Well, I think that's about it. Thank you.
Question. So, Maria, kaya tuling sa adol batela mundi. Thank you, Dr. Bing. I think it really comes to show that during these times, and even though we don't have identified cases yet, these are some of the impacts, the indirect impacts that pandemic causes. So first of all, you have the anxiety about the disease itself, and then you have a period where people are anxious about the possibility for them to lose their jobs, to be laid off, and then we have this relief aid that comes in and sort of creates another issue that we need to deal with. But again, they're all public health issues that really need our attention and, of course, awareness, even without a confirmed case yet. So thank you, Dr. B, for that. And again, what's the number that they can call?
488-1907.
1907. And then if they need some guidance or just need to talk to someone, there's also the hotline, of course, this hotline, 488-TALK.
Yeah.
So take it again, Dr. Bing. For an alcoholic who comes into BH for detox, after he or she finishes with the detoxification, but starts drinking afterwards, is the drinking going to be worse than before?
Well, as we tell our clients and patients, relapse is also part of the treatment, because like I said, it's very difficult for those who are addicted or dependent, who have become addicted or dependent on alcohol, to really, get out of it easily. So there will be times, because of the craving, that's main thing. They crave for it, even if they're getting themselves into physical and emotional problems, even with troubles with the law. When they crave for it, and then it's like just a sip of alcohol will get them back into drinking it. So when they start to relapse, it's best that they come in right after, so that the withdrawal won't be as worse. But if they really continue with it and seek treatment much later, then the withdrawal symptoms could be worse. And for those who are relapsing, well, it depends really on their willpower. Okay, so if they really want to quit, that's why at the start of the session, I asked them, what's your expectation? Because if their only expectation is to cut down or to, just to drink occasionally when they're already addicted or dependent on it, then it will be harder for them, because you really have to stop drinking. That's the only way to really stop the withdrawal symptoms. Because that's the thing with the substance abuse. They develop the tolerance. Before they some of them say they just drink to have them sleep.
Yeah.
So they consume maybe 3 cans of beer. But then when they develop the tolerance, they end up consuming more. And if they consume more, then that's how it goes. The more bottles or cans that they will consume. And the harder it is for them to quit, because they will develop tolerance symptoms if they stop using those substances. Like if they quit the drinking alcohol, they will develop withdrawal symptoms. They can develop withdrawal symptoms such as nausea, vomiting, dizziness, confusion, and makes tremors particularly. So it makes it harder for them, and there will be the craving. Even if they're able to detox and stop, there will still be the craving to consider. And that's why we are asking the family for their support. Is very important, because there are those who feel like even just one can is okay for a recovering addict or substance user. But what they do not realize is even just a sip will get that person back into their addiction. So we are hoping that there are those people who, during parties they say, just one can, or just a sip, but they do not realize that they would be putting that person's life and also their families in distress later on. Yes. Because if they go back to using the substance, then it creates distress within the person and the loved ones and families, and also it creates dysfunction when they are working or studying, if they're students.
Okay. Well, I'm thinking like it's going to get worse because once they run out of that money that the United States is giving us or government is giving us, and when they start having financial problems, not enough money to keep the family going, then that's going to add more problems to the family, and those responsible or obligated for a family are going to be having a hard time, and that will also translate into mental problems, because they cannot figure out how we want to take care of my family, and I don't have a job, I ain't got no money, I got bills to pay, so open up more rooms in your clinic, because there are going to be more people coming over.
Well, in every pandemic crisis, it is expected that the psychiatric cases will increase.
Right.
So Dr. Bing, you're saying that when a person finishes with the detox phase, what do you recommend? Counseling?
Yes, we still do counseling even if they have finished with the detox, or they have succeeded in finishing the substance abuse treatment program that we have. We still do the counseling and monitor them. We still schedule them for monthly or twice, every 2 months follow up with us, because we want to monitor their progress. We want to make sure that they are sober and that they're also having activities to do, so that they would not go back to drinking drinking this alcohol or getting into other illicit drugs.
Right. And then, so I think the current definition or explanation of binge drinking is five or more drinks for men and four or more for women within 2 hours. I think that's the current. But in terms of the alcoholism, it's always a joke. You go somewhere and then you say, "Oh, alam lang mo alcoholic," or
I see.
So what are the actual signs and symptoms of alcoholism? How can you diagnose if there is such thing as someone being an alcoholic?
Well, when they are diagnosed with alcohol use disorder, these are the people who are consuming alcohol more than they're supposed to, or for extended periods of time within the year, okay? And this has caused them problems, which has caused dysfunction and emotional distress, and they are spending so much time trying to get the substance no matter what the cost. So there are those who turn to stealing also. Okay, and there are those who, of course, they also don't really see that it can lead to, the consequences of negative consequences, such as problems in relationships, and also with the physical and emotional problems that come with it. It can cause rifts in relationship, and also dysfunction at work or at school. Okay, and yet they still consume the alcohol. And even if they're having already health issues, they would still consume alcohol. So it's really a difficult thing to get out of for those who are already alcoholic and became dependent to alcohol. They would think that the alcohol helps them. Some would think that it helps them to sleep. But actually, alcohol only makes you drowsy, okay? It does not promote good sleep. It only promotes fragmented sleep, okay? Short intervals of sleep. So it does not produce that continuous sleep. That's why when you drink, you might get drowsy, and then you fall asleep. But then you wake up, if you notice, you wake up right away, only a few hours maybe. So it's not the quality of sleep that you're looking for. And if they do that for a long period of time, for those chronic alcoholics, then their sleep cycle, will actually be destroyed by alcohol. So for chronic alcoholics, they have problems sleeping. And that's why they consume more alcohol, thinking that it will help them. But in reality, it is destroying their sleep cycle.
So here's another question, Dr. May. This person asks, so what are some simple alternative or healthier ways for them to deal with the stress or anxiety as opposed to turning to substance use and abuse?
Well, like as we have been saying, there are productive ways, okay, that we can turn to. But first, of course, to relieve the anxiety, you find ways on how to relax. And there are meditation techniques, breathing and relaxation techniques that they can use. Okay? The mindfulness meditation is very effective for me. There are breathing exercises they can do. And of course, the exercise, they can engage in exercise activities, okay? And just like also what Mr. Diaz told us, one time he's into gardening. The gardening can be therapeutic, okay? So in a way, they're also helping with the environment when they do the gardening, and that's very productive. And some people, they relax by watching a movie, or, playing soft music, and those people who like to read, a good book would be relaxing for them. Okay? And of course, bonding with the family, because bonding with the families strengthens the love and connection with each member, so it helps them. Or with the spouse, of course, the partners, being intimate with each other, finding ways to be intimate, and rediscovering, when you're in quarantine or family, you can rediscover each other when you become more intimate. Okay, and that also brings up the dopamine levels, which is the pleasure hormone, and it helps you feel good. And the exercise, it promotes the production of serotonin in the brain. And serotonin is the feel-good hormone, so that it makes you feel good. Okay? And of course, engaging in other activities that makes you feel good. For the children, maybe fun, playful activities. Okay, maybe you can introduce to your sons and daughters the traditional Palawan games that you used to do when you were young, and maybe they're not aware of that. They just might find it, surprising and joyful too.
Okay, Dr. Ving, what is your advice to those people in quarantine at this time? What you should tell them, to watch TV or what? Can you advise them what to do and what not to do?
Well, those in quarantine, it will help them if they would set out a regular activity for them, just like if they're in an office or school, and set an activity for them to learn, and also set some activity for leisure. So they can watch TV and surf the internet for some of the things that would be educating them.
Yeah,
that's the learning part, and then watching a movie or maybe watching some videos or listening to music.
Right. But I'm thinking,
also help them.
Kafar, I'm thinking like, can you come up with some sort of program, a physical exercise and stuff like that, and give them like a brochure of how to exercise, warm up exercise and all of that?
Yes, that's a good suggestion.
Yeah.
Because exercising, like I said, promotes the increased production of serotonin to make them feel good.
Yeah.
Okay, that would be a good suggestion. That's a good suggestion.
Yeah.
Really is.
Okay. So those guys in confined to that small room, at least they have a list of exercise that they can, keep their body and mind in the right order.
Yes.
Yeah. Okay, we got about 4 more minutes to go, Kafar, so...
Yeah, there's two more questions for Dr. Ving. So
okay.
the first one is how many of you and your colleagues, counselors, and if there's other clinicians with you working with all of these cases? That's the first question.
I don't have the exact numbers of our counselors, but I think, there are 2 psychiatrists, me and Dr. Sylvia Wally, and then we have counselors, social workers, maybe numbering around 10, and there are those whom we are training right now, undergoing training for crisis. I've just finished a month ago training in crisis counseling, and also those whom I trained with on how to do critical incident stress debriefing, and it has been very effective for our frontliners and primary those who are on the front lines managing the COVID crisis.
Okay. And then the final question is, this is a question about the CBD and whether or not it's a good alternative for relaxation and other.
Well, cannabidiol is the pure cannabidiol does not cause the euphoric high that you get from THC or the tetrahydrocannabinol from marijuana. And the cannabidiol is the one that is being used as a medical marijuana. And the THC that is being used is the synthetic one to improve the appetite. So these are in controlled dosages, small dosages and controlled. So that because they're still addictive, okay? They can still cause addiction. And that is why that's the controversy there. But then the cannabidiol does not cause the high that the addicts in marijuana are looking for. Okay, and cannabidiol has been, in terms of FDA approval, as far as I know, I haven't been aware lately of if there's any new approval, but there have been only 3 approved use of medical marijuana. Okay? Now, the other uses of medical marijuana would depend on every state in the U.S. The first approved use is for those who have cancer and have lack of appetite, and they're using the synthetic THC. And then the cannabidiol has been approved in 2 rare seizure disorders that have been difficult to treat with medications for seizure. But it is not like it's going to treat all of the seizure. So it's an alternative medication. It's not the primary medication.
Okay.
Okay.
Thank you, Dr. Bing. Ating lagi kita tulik.
Okay, lagi kau mansau rogui, mansau na audience lagi deh pada buat kopi.
So thank you, Dr. Bing. Sulang and Peter. Book next time sa May. Di ko kumuktat ke tulig ra cell hotline ra COVID 488-0555. Sige dito book crisis hotline na sumo niya adro ko di soal mo dadura kumukta ko naman niya abroad na
Magsuy.
Lagulo, swell, sa Water State 775 talk, sa 775-8255. Direct sa Ilocos na PH outpatient 488-1907.
Okay.
So kung sorry, ko na rule appointment, may besa na Dr. Big.
Okay.
Di ba sa inyo, tuloy, kung mansula, kung maradala, madalwela, mabuk next week na ang rule year.
Okay, bye-bye na.
Suna.
Suna. Kung man sa Rogui, next week, Tuesday, put me stay with us so we can update you guys of what we are doing and how we're gonna stay COVID-19 free. So far, so good. So keep praying for us and may God bless you all. Bye bye now.